Junkalunka, Junkalunka, Junkalunka,
Yeah,
Junkalunka. What up, Charles?
nothing much, brother. How are you tonight?
Freezing.
Well, I've never seen my inside of my freezer melt because it's warmer than outside temperature. It's cold, man. It's cold.
Oh, I today, believe it or not, I had to actually run the heater in my truck, bro.
Yeah.
I've never used my heater. I know not in this truck that I have. I just don't remember the last time I used the heater. I had to put on the heater, man. It was cold. It was cold. I looked at the thermometer in the truck. It was 63 degrees.
Right.
And
It
it was
is.
cold, man. It was cold. I don't know how those guys are doing it on the mainland with the negative temperatures and 2 and 3 feet of snow and snowing on Maui right now, bro. Snowing on Maui.
Yep. That's what my son said.
Pretty
He
cool.
said, Dad, it's snowing. When I lived there, I went with my brother-in-law. We went up to Haleakala, and the biggest mistake I made is I just, you policemen, you think you all that, right? So I go up there. I figure I'll run around just in shorts, no shirt. You know what? You know what the seriousness of it was. It was first you get that altitude right up there, so you get a little bit, you get lightheaded. In fact, you get a headache. But then your body starts to compensate, try to overcompensate to warm you up. So it has this mean burning feeling. And I tell you, I will never ever do that again. That is the dumbest thing I ever did. But I was only 25 at the time that I did it.
Yeah.
You
Yeah,
do
you
it right
do.
now. You do it right now. I come home in one casket, guarantee.
Yeah.
So,
Yeah. I think as we get older, we get wiser. We
yep.
get wiser. Hey, tonight we got an amazing show tonight. For those of you that are on and coming on, we got HHSC representatives, leaders in the HHSC, and I'm gonna let Charlie introduce these people as we bring them in. But I wanted to read a post that I just got, Charlie, and I think
Okay.
you got it as well.
Yeah.
It's from Leah Custer, and we talk about our group. We've become an ohana. We've become a family. The bonds that have been created, although we have not personally met face to face, the bond is like we've known each other for years and years and years. But Leah Custer messaged me 10 minutes ago, and I'm going to read it. I hope she doesn't mind. Um, and this is about one of our heroes that are on our show. That's on our show every night. And she says, "Thank you to one of our own front liner, Uncle Charlie, Iona, and Mel Raposo. I finally met her. She is the best Hanai BFF sister, and most of all, bless her heart. Melissa Bolton, I'm talking about you, girl. Thank you, thank you. I'm going to use it in my life. I'm sorry, I'm going to use it in my class and at home. Many thanks for coming into my life via the Mel and Uncle Charlie show. If it was possible, I would have gladly given you the biggest hug ever. Thank you, Uncle Charlie and Auntie Stephanie, Mel and Patsy. You guys would have done the same if you saw Melissa. It's like you would know her to be one of your family members, and she is through all of you. One day soon we will have a potluck.
Yeah.
What she's talking about is our own Melissa Bolton went and delivered again on her own expense PPE to Leah Custer, um, because it's not available. So Melissa, again, being Melissa, went out as she does so often and does never gets recognized. That's why I wanted to read this. She went and delivered PPE today to Leah Custer, and Leah sent us this note to thank Melissa and basically say that she's an angel and she's the best Hanai sister BFF. So Melissa, we love you, girl. Thank you, and thank you, Leah, for sharing that. Yeah, we would never have known, never have known. So thank you so much.
Well, it's amazing what this 1 hour a night has done. And I've said it before, and I'll say it again. When we give information that's, it's not us. We're just, we're just a vessel, a willing vessel to help in any way possible, because we've always felt that not enough information was getting out to help people. So a lot of you, like myself, we were left in this suspended animation, if you want to call it that. It was just this suspenseful time, like, what do we do? Who do we believe? And through that, we started to see how people from the different islands, different cultures started to gravitate, because we had one thing in common, and that is we weren't going to be like anybody else that believed that this was a hoax, that this was for real. And we started to rely on each other. We started to rely on the information that each other was sharing. And through that, and just by watching on the show, we started to see the different names, and we started to communicate on private messaging. And that's how this developed. And I know this will go on when when we reach the final show, whenever that is. But I know it will go on.
Next week,
Everybody,
next week Friday,
oh,
next
don't
week Friday, next week Friday.
we'll start putting, now we'll get threatened again, like we did the first time when we never come on and we never get fair warning. So, it's all about um, really family helping family, even if we're not related by blood, but we are definitely related by a kinship that is special, and probably you will not find it anywhere else in this entire world, but right here, right here.
Awesome stuff. Awesome stuff. Tonight, folks, we have again members of the HHSC. I'll let Charlie uh, do the intro. Charlie invited these fine people to come on tonight to share information on the vaccine rollout. A lot of questions about the vaccine and how it's being rolled out here on Kauai and throughout the state. So, Charlie, go for it, buddy. They're not here yet. They should be popping on any moment now, but maybe you can share a little bit about HHSC and what their role and function is here on Kauai, right throughout the state for that matter.
Well, HHSC is the Hawaii Health Systems Corporation. It's an entity that I believe it's sort of like the ADC, if you want to consider it that. That was developed for in the medical field, the hospital. So throughout the state, Kauai, of course, has Kauai Veterans Memorial Hospital and Samuel Mahelona Hospital, the two campuses that's operated by HHSC. And Honolulu has Leahi Hospital. Um, the Big Island, I believe, has Hilo General, and I believe Kona is the other. And I may be missing some, and I apologize to those who are watching who are part of the HHSC chain. But if you know, please put it on the comments there to correct me. And if I need to stand to be corrected, then so be it, because I don't want to leave anyone out. But anyway, this, I can only speak for Kauai. They've been through some tough times financially and so forth, but with the great help of uh, the executive board and each regional board, they have put their heads together in trying to keep the facilities open, which they did a great job, and it's doing really really well. And we're very thankful because if you think about it, between KVMH on the west side and Lihue, when you go if you to go to Wilcox, there's like almost a 30-mile difference in between. So you have a facility here that can really go into a triage situation, stabilize, and get the needed help. Like I said, I was one of those that benefited. I was a benefactor, I should say, because I benefited from their services when I was about to have a heart attack. They stabilized me at KVMH and they rolled me out to Pacific Missile Range to put me on medevac and sent me straight over to Honolulu to Queens Medical Center. So those are the kind of things that brings this uniqueness to, I guess, the rural areas of the islands. And I know every island. And somebody wrote Kahuku Hospital. Yes, thank you for letting me know that. Yeah. And then of course they have all the different clinics, Port Allen, Kalaheo, all the different clinics. Holahui is partnering with the HHSC. So they have the community clinics inside the facilities, both at KVMH as well as Samuel Mahilona. So tonight, our three guests, we are very fortunate to have Dr. Ronald, and you know him very well, Mel, Dr. Ronald Fujimoto, who is the COO, and he also is, and I got his bio here, and I just lost it. Oh my gosh. Okay, here you go. He's a family practice. He's the regional chief medical officer. Okay, then we have Sherry Lauer, who's a regional chief quality officer. And finally, we have Cheryl Tenberg, who's the regional chief nurse executive. What a powerful team. There are other members that comprises of the hospital, like the president and the CFO, the chief financial officer. But with all of them in place right now, we are in very good hands. We are in very good hands. So I'm very, very honored to have them on tonight. And yes, ladies and gentlemen, if you're watching right now, please share this. I think it'll be very interesting because, as you know, within the next couple of months, we will be having new vaccines roll out, one-dose vaccines like J&J, Johnson. I believe AstraZeneca too is a one-dose, and you're not required to have those extreme freezing temperatures like the Moderna or Pfizer vaccines. So here we have guest number one who's on with us tonight. And this is Dr. Fujimoto.
Dr. Fujimoto, how are you, my friend?
He's lining up his audio. So anyway, as he's getting his audio ready, we have a lot to talk about tonight. So I'm hoping that all of you can chime in, and if we can get to your questions, it'd be perfect. It'd be perfect. And there is Sherry. That's the lovely Sherry Lauer, our regional chief quality officer. Okay. And
can you guys all hear us? Can you hear us?
Okay, Sherry, can you hear us? Sherry? Sherry, were you able to hear?
Oh, okay.
There's Cheryl Tenberg and Sherry's there, and we're just waiting. Are you able to? Can you say something to? There's a little icon on the bottom of your screen. Yeah. Okay, there you go. Okay, there you go.
Yeah.
Can you help Dr. Fujimoto?
Let us move my computer. Sorry. Okay. You get to take a walk with Sherry. Let's try this.
Okay.
You're gonna have to squeeze in here. We're gonna all have to.
Oh, we got all three of them that way. Okay.
Yes.
I got you. So can you hear us okay now?
Yeah.
Okay. Well, good evening, good evening, good evening. We like to say aloha and thank you for joining us tonight. I know you folks have been very, very busy over the last couple of weeks with the rollout. We have a lot of people. We have about right now we have about 130 people that's viewing, and the number is still climbing, and there's questions already coming in, but we want to thank you first of all for sharing some of your time with us tonight. I know you've been very, very busy. If you don't know who Mel is, that's Mel over there.
I know
We know him.
We know him.
We know.
Hey, I'm actually a really nice guy. Okay, I'm really a nice guy. Contrary to what you may have heard.
We know you're a nice guy.
Thank you. Thank you all for being here tonight. A lot of people are waiting. You know, let's just say there's been a lot of confusion, a lot of anxiety, excitement, a lot of emotions because of course, because of COVID, but with the vaccine, and so we kind of wanted to. And we appreciate you guys being here to share with us everything you know in an hour, and help inform and educate our viewers on the vaccine, the rollout, and what's happening right now and what's to be expected. So we'll turn it over to you all. You guys can manage the time how you want. If there's questions, we'll go ahead and pop in a question here or there. But that's kind of what we want. Just kind of give us an overview of how we got to where we're at, and where we're going.
And before you go on, I do want to put in a disclaimer, because a lot of our guests think, "Ooh, boy, an hour is a long time." But once we start rocking and rolling, because we're going to be giving in comments here and there, next thing you know, the hour just went fly by so fast. So I just want to let you folks know that, okay? So who wants to go first and just give us a little breakdown of HHSC and KVMH and Mahilona on Kauai?
Okay, I guess I'll start. Hi, I'm Dr. Ron Fujimoto. I'm the regional CMO. Cheryl Tenberg is our chief nurse executive, and Sherry Lauer is our chief quality officer. They are doing pretty much most of the organization, and they'll probably be spending most of the time explaining what we've been doing. A lot of work behind the scenes, but this has been going on for about a month, I think, when we started with the first group, which is really vaccinating our own staff. So obviously we're using the Pfizer vaccine, which is a messenger RNA vaccine. The health department is doing the Moderna. All of us have gotten our second shots, but I think most of the activity and the excitement comes from the next phase, which is vaccinating the over 75-year-old age group. So with that said, I'm going to turn it over to these two, and if there's questions, then I'll help answer.
So we started our vaccinations for the staff started on December 22nd. And currently we are up to 80.
We're over 80% of
Over
our staff have
80%,
had their vaccination. Some of them are still waiting for their second dose.
And we're sprinkling them in with our clinics. But we started doing the vaccination for the Kupuna, which is the 75 and older, and we started that on January 15th. So far, we've held clinics for the Kupuna on the 15th. We did it on the 19th, the 22nd, right? And then the 26th and the 29th. And then we had one again today on the 3rd. We're holding them on both sides. So we're holding them at both KVMH and also at Maholona. And what we're trying to do is, if we close off, and we only have so much vials per day that we are allowed to use, we've been very fortunate in that we've been able to pull almost 6 doses per vial, which normally you're only supposed to get 5, but we've been able to get 6. And I think that's because we have amazing pharmacists that are just really diligent on getting that 6th shot and the right needle and so on and so forth. So with that, we have not wasted one single dose whatsoever. We keep everybody gets the shot. If people don't show up, we find an arm to put that shot in. So we have been able to be make sure that we have a wait list for the Kupuna. So if you can't get into the clinic, we take names for 75 and older. And I really need to stress that we do have a wait list for the Kupuna for the 75 and older, not for anyone under 75. So there's a lot of people that show up at the end of the clinics that are like, hey, I want to be on the wait list. And we do have people that we do put those shots in arms with as well.
I want to go back just a step and kind of tell you about Pfizer vaccines. So The hospitals were able to get Pfizer vaccines because they were able to secure cold storage. That vaccine needs to be kept minus 70 degrees in an ultra cold freezer. And in there, it's supposed to be good until expiration date or up to 6 months.
Mhm.
The
Right.
kicker is, and the logistics of all the clinics are making sure that we can pull the vaccine from Wilcox. So Wilcox has the freezer on the island. The vaccine is flown into them, and then we pick up what we need in collaboration with their clinics. So we've done several runs to Wilcox. You have to have dry ice and a big chest that it ships in to pick it up to be able to transport it to our facilities. First drop off is Mahilona. We put it in the refrigerator there. Once we pull it from Wilcox and put it into our pharmacy refrigerators, it's only good for 5 days. So we need to make sure that we're not pulling too much. We can only pull enough for the people that are registered for those clinics. And I think that's where the confusion comes along is we pull everything if we could, make sure that we can get the people into the clinics, but we can only pull to the point where they're registered.
Yeah.
So for example, yesterday we had a small clinic today, only 60 at KVMH and 54 at Mahilona. But yesterday at noon, we had to say, okay, what do you have on the registration for right now? Because we need to go pick up the vaccine. And that's the unfortunate part, because we did get calls yesterday afternoon and they didn't quite understand why we couldn't put them on the list today. It's not that we don't want to, it's just that we didn't pick up enough vaccine to be able to handle more people than what we thought we could have.
We didn't want to wait.
Correct. And the other logistics today were the rain. The rain really, I was very surprised. The majority of the Kapuna came out for the vaccine despite the rain, which really, that's a testament to them really wanting to get vaccinated and protect themselves. Because it was not fun today.
It was not fun.
The rain was not fun. Yeah.
Let me ask you, at the very, very onset, there were, I guess, some talk that maybe some people were electing not to get vaccinated.
Mm-hmm.
Have you seen that mindset change where people want to get vaccinated as opposed to not wanting to get vaccinated?
We've seen it with our staff, especially. We had a lot of staff and we asked them why they didn't want to take it in the beginning. And the majority of them wanted to kind of wait to see how everybody else was reacting to it. Some were adamantly against it, very few. The rest just wanted to kind of wait for a few doses down the road. But what we're finding now is they've seen that because our reactions have been minimal. I mean, the majority of people have nothing. Some of us have a little tenderness at the injection site. And after the second dose, maybe you have a little more reaction around the area. But for the most part, it's been very minimal.
Yeah.
So now everybody wants to get it because they feel that the ticket to travel is going to be having that double vaccination on board. And a lot of them are hoping that down the road, not too far in the future, they can take a trip.
Well, Mel, you got any questions, Mel?
Yeah, I just really appreciate that information. And I just, by the comments that I'm seeing, people appreciate that because they don't know the logistical nightmare to deal with this vaccine that needs to be in a sub-freezing state. Yeah. So real quick, just for our viewers' sake and as well as mine, it gets flown to Kauai. It has to be in this amazing freezer. It goes to Wilcox, and then the entities that are vaccinating people get it from Wilcox. And from the moment they take it out of that freezer at Wilcox, you have 5 days to use that vaccine. Is that correct?
It's got to be kept in a hospital grade freezer, refrigerator, right?
It's in cold storage in a medical grade cold refrigerator.
Only for 5 days.
For 5 days, correct.
And again, because I heard there were some rumors running around that that vaccines are being wasted. You have created a waiting list of 75 and over patients that if you realize that some people did not make their registration appointment, you have a list to call from. Hey, come on down. We got a dose for you, and that's how you're getting rid of the unused vaccines.
Correct. And typically around 11 o'clock, we start looking to see if people didn't show up at 9. So it's very important as well that people show up on time for their dosage. Otherwise, we're sitting there waiting. And today I had 2 people sitting there waiting to see if the person didn't show up. And And that happened because they were 76, and they're sitting there waiting, and they're like, I really want to get this shot today. I know I'm on the waiting list, but I'm just gonna wait here. And we're like, okay. But we, everybody's really excited to get the shot. And what we found is people are coming early, and that's great. They're coming in, they're scheduled, and that's the first thing we say. Are you scheduled today? And we go through our list and we look to see if they're on our list and they're scheduled. So we want to make sure that we really do adhere to that, because we do only pull, as we told you, so many vaccinations per day so that we don't waste any. But I can absolutely assure you, we have not wasted one vaccine at either of our clinics.
I know everybody's heard across the nation that they're really trying to pull that 6th dose because we want the vaccine to go as far as it can. So we get at minimum 5, and for them, I think we're hitting almost 100% for the last 5 clinics at KVMH getting that 6th dose, and Mahilona almost.
I had 2, last week we had 2 that only pulled 5.
And the reason that is, just to explain, is you're pulling it up with a needle, depending on the needle. And we found that the needles that actually ship from the CDC for us to use, because they did send some supplies, you can't get 6 doses if you use those needles.
Mm-mm.
We found if we use the smaller gauge needle, which is actually nicer to give the injection in your arm, it pulls consistently that 6th dose. So we've kind of mastered that right now.
Yep.
Which allows us to vaccinate every vial. You get 1 more person vaccinated, which is great.
Mm-hmm.
And sometimes we do have to pull and have a little leeway, because our poor pharmacists, we don't want to give them a lot of anxiety with that, always saying, you got to get 6. I got people waiting. So what we'll do is sometimes we'll pull, like we need to give them a cushion, so that way if they pull 5 doses instead of 6, that they have a little cushion. And that's where that waiting list really comes into play, is that we want to have a cushion. I don't want to have somebody come in that's scheduled and not have a dose for them. So we have to make sure that we do, consider those considerations. And so what we do is have a little extra at the end, and that's what the waiting list is for. And that's why we get people in at the end.
We pull 1 more vial. So potentially we can give up to 6 more people at the end of the day if we're
100%
able to
with
pull
our
those
pulls.
6 doses.
Mhm.
For our viewers that just joined us, we're noticing that some people just jumped on. If you're looking at your screen from left to right is Dr. Ronald Fujimoto, and in the center is Cheryl Tenberg, and to the right of the screen is Sherry Lauer with HHSC. And again, these are the fine people that operate and keep everyone safe, both at KVMH, Kauai Veterans Memorial Hospital, as well as the Samuel Mahilona Hospital. Now I'm going to put Dr. Fujimoto on the spot, very gingerly. This is not a political question, because we are talking about vaccines. One of our state officials constantly, and we get bombarded with this all the time. I mean, if you look at some of our feeds, even because we do this nightly, except Sundays, we talk about COVID. And as you know, my brother was one of the first victims in the United States. He was one of the first 3,000 that passed away in New York. So I have this passion to really understand about COVID. But one of our state officials makes it known that, once you get the 2 vaccination, there's all this hope, and that's what we want. But yet right now, there's not enough data that leads us to believe, and we're still waiting for that. And that's why I wanted to ask you, Dr. Fujimoto, your take on it. And that's about the transmissibility, that even though you got vaccinated, you still can be a carrier, basically be an asymptomatic carrier, because the impact on you would be lesser because you got the vaccine, right? But you still can transmit it. But we have someone telling a lot of the viewers, and this is regularly now, and we have people that are still confused about the vaccine. You kind of would you like to kind of address that?
Okay, what I can share is what I know, and you're absolutely right that COVID-19 invented the word fluid. We're learning things every single day. So as we say something, as we print something, it's not unusual to have an update later as we find out more about it. You're absolutely right. Everything that you said is what we know at this point. And that is that currently the 2 shots, 2 weeks after the 2 shots, it will give you some immunity against the COVID vaccine. Pfizer has a slightly, just a slight higher effectiveness than Moderna, but both are in the same ballpark. As far as the ability to continue to have an asymptomatic carrier state, now that is a kind of theoretical, and that's also based on other vaccines that we know about, like measles. I don't know enough about it to comment on that, except that with the other vaccines, even though they're carrier states, they don't transmit as easily as, let's say, someone who was not vaccinated. So that's all I can share. I mean, you know, you're welcome to ask the real experts. My background is family practice. I have been reading a lot about the vaccine, but again, as you said, there's very little given about the vaccines and what we know about it. For example, we don't know how long its effectiveness is going to last. We don't know at this point whether or not a booster will be required or not. There is talk that Moderna might have a 3rd shot. But again, a lot of things that we're learning every single day. Great
Well,
question.
the only reason, and again, I apologize, I asked you because you're the only doctor on the panel today, and we've been hearing a lot of information provided by Dr. Fauci, and because you're here, the people who agree with me, I mean, you better looking than Dr. Fauci, so that's why I went straight to you. But thank you, Mel.
Yeah. Before I go on, I did want to say that my wife and my mother-in-law got the vaccine at Mahilona Hospital about 2 weeks ago. That was when the caregiver program was still going. And I just wanted to say that the process was flawless. The process was so effective or efficient. I just wanted to say that for your information. I'm not sure who, I don't know the names. I wasn't there, but my wife was completely blown away with the efficiency of the operation up there. They were in and out. Obviously after the waiting period, but they were in and out in no time. So thank you all for having an amazing system at both of the hospitals. I just want to let you guys know that. I did want to ask, the caregiver program was in place for a little while, but due to the lack of vaccines, that was stopped. What is the situation with that right now? Is that still not happening anymore?
We're still waiting for Libby Char to give us further directions for the Department of Health for the state. They want us to follow suit. So right now we're not to give the caregivers vaccine.
Thank you.
But we will,
Excuse
if
me.
you had your first vaccine and you were a caregiver, we will give you your 2nd shot, and that will be on the 9th, the 10th, or the 12th next week. We were giving, so if you were a caregiver and you got your first dose, we're going to give you your 2nd dose. So don't be alarmed that you wouldn't get your 2nd dose.
The other population that we've vaccinated, we started over here at KVMH, is some agricultural workers. That's through the Department of Health. They were actually vaccinating because they're part of the same group as the 75 plus. And they were supposed to go into the convention center and get vaccinated, but it's difficult for them to get away from work that long. So they asked if we could do the vaccinations at KVMH and Mahilona. So we have done, I believe it was 14 that we did last week here at KVMH. So you are going to see some younger ones that come in with our elderly through these vaccination clinics. And some of them are healthcare workers because we're still finishing up some community healthcare workers, as well as some of our staff that changed their mind. So when people see young people in line with the elderly, they kind of think that we're doing caregivers. I think sometimes, I think there might be a little confusion, but we're not doing caregivers.
Except for the 2nd dose.
Yeah, the 2nd dose. We will take care of everybody that came in and had their first dose. They need to have the 2. And
Now,
we are starting that next week. We'll be on our 2nd dose on February 9th, 10th, and 12th. And then the following week, we're targeting the 17th and 18th for the second doses for the clinics we've had so far. And we have a lot of people coming through next week.
We have about 1,000 people that we're going to have to get in the next 2 weeks between the two facilities. So it's a lot, but thank you for saying that. That's why it's so important that we do run it the way we do, and we're very careful of the registration process and moving it through. And there's no one just standing around, because not only do we have to worry about getting people through it, with a lot of people through, we also need to be cognizant of them having that 6-foot distance, socially isolating. It's a little difficult. So that's why I'm kind of out there going, I'm sorry, you're going to need to stay outside, or, and really manage the crowd component of it, because we don't want to put anybody in danger. So we're very careful with our space, with where we're putting people, so that you do have a safe place to get your vaccination.
There was two things, and I want to thank you for providing you talked about the ag worker, or that classification that at 75 and over. There was a gentleman that I sent over to you folks because he was turned away. He was supposed to get his shot at the convention hall, but because he had an allergy, they said that, oh, we can't do it here. And I was kind of shocked to think that, well, then how do you have that observation period? Is there not a EMS person standing by? I'm pretty sure he's not the only one that got turned away. So I think, I did send a shout out to Dr. Berman to say, are you folks, and she said she would look into it, because it'll be kind of frightening that if we are trying to so-called achieve that herd immunity, that means that everyone participates who wants to get it, right?
Right.
The fear that I have is that if the vaccines dry up and we can only vaccinate 70 people, we've reached our target mark. But at the same token, that 30%, there's probably a good bunch of them that wanted to get vaccine, but there's no more vaccine left.
Yeah.
And so that's how, we're trying to get everybody to, to actually get in there to get vaccinated. But I did want to ask you about there was this question, and I think you answered it before, but maybe for the viewers, Cheryl, pertaining to the classifications about essential workers, because, and again, we don't know how this thing played out, and it kind of puts undue pressure on the vaccination sites, and yet you folks are taking your lead from the Department of Health, who is Dr. Char. So I want the viewers to know that this is not something that KVMH is just making up right now, or Mahelona. They're getting their marching orders from someone, and that's the Department of Health.
It actually goes back further than that, because it goes to the CDC. The CDC came up with the different phases of vaccination. And from there, each state developed their own programs of how they were going to roll out the vaccinations. So it's kind of tiered down. And then to us, we follow what we are asked to do. We want to collaborate and do everything right. So it's going to get out to everybody.
Yes.
It's just is taking a little bit of time.
Well, I think the question that I had, though, and I wanted to make sure that the people understood it, because the question was posed to me. They said, hey, when the virus first hit, there were many of us essential workers, we wanted to close down, but we were mandated, we were ordered to stay open. We're deemed essential. So now when the essential workers start getting vaccinated, there's essential workers like agriculture, right? Farm workers, they're considered essential. Grocery stores, essential. But then you get hardware stores that was deemed essential, but they're not essential enough to get vaccinated right now.
Yeah, I know.
Yeah, so I think maybe, this is kind of like a Monday night quarterback in this thing. Maybe they could have used a different verbiage, I guess, to kind of make it understandable why there's that separation. But that question always pops up on some of our feeds. That says, hey, we fall into this essential class. How come we don't get to go? And, I really don't have the answer for it,
Yeah, and then there's that population too that is medically at risk. They don't meet the age requirements, but they're medically high risk. And we get calls from people that are in tears wanting to get the vaccine for their children, their adult children, or their father, or whoever it is that needs it at some point. But right now, we're not authorized to give it to them. And that's a hard thing to do. You know, we'd give it to everybody if we could. We want to keep everybody safe.
Yeah, we want to get, I mean, it's not that we don't want to, but we're being told by the Department of Health, we have to do this age group, and this is where our focus needs to be. And I have people tell me every clinic, well, I have, you know, so I have all these different things. And I'm like, you know what, you're going to, in the next group, you're going to get that vaccine. But right now I'm only allowed to give it to this group at this time. And, you know, and that's where it really breaks our hearts. It's probably the hardest thing I do at each of these clinics. And they're always like, oh, Sherry, we need you to go talk to someone. And I'm like, oh, you know, but I think that, I mean, know that we, you know, it's from a place of caring. I mean, we've been nurses and Dr. Fujimoto's been a physician for a very long periods of time, and we care about our community. We want you to get the shot. We just have to make sure that we roll it out correctly.
You know, on a brighter note, the vaccine should become more available next month.
Yeah.
Right now, Pfizer's doing some improvements to their plants to speed up production. So things are starting to escalate as far as availability. The other thing that's happening is a lot of other sources for vaccinations are becoming available. You know, you have CVS that initially was contracted to go out and do the long-term care facilities, and they've done that already. So they're starting to move out to the community. Ha'ola Lahui, our partner downstairs that is in our space, they're starting to roll out vaccinations for their clients, 75 and older. And they're getting the Moderna vaccine, which is much easier to store because you don't need the ultra cold freezer, and they can give 10 doses per vial. So I talked to Dr. Chong Hansen today, and he said that they're trying to schedule 10 people, twice a week over here to get their vaccinations. So there's other resources to get the vaccine. It'll happen.
It's rolling out. We'll get
So
you.
let me ask you, as far as the time frame that you got to deal with, is it when it's defrosted, or it's when that vial is punctured with the first draw, that's when the clock starts? I mean,
It starts when we pull it from the freezer.
When we pull it from the ultra cold storage, it's when we pull it from our dry ice and put it into the pharmacy grade, refrigerator system. We have 5 days. We document what time we put it in, and we know we have 5 days at this hour. And then from there, when we pull it, and it takes a half hour to defrost, but when we pull it out, once we bring it to the clinic, we then have 6 hours. Once we dilute it and get it ready, we have 6 hours to get that into an arm. So that's why we have our clinics for 4 hours. We make sure that we're within our time period, and it gives us some time to call and get additional people there. So that's why we run our clinics from 8 to 12, but we typically start getting shots at 7:45. But that's why we run our clinics at that time period, so that we're safe and that we know that we are not gonna have it longer than 6 hours. So
That's why, Mel, I was telling you, remember when I got my shot, I told you it felt like slush. It was still frozen. Gave it to me as well.
It's still pretty cold, but it's not frozen.
Yeah. At KVMH, our pharmacist, Chrissy Canavan, has done a wonderful job, and Darren's done a great job on the other side.
I love Darren.
I haven't worked with Darren because I've been at KVMH. Sherry's been over at Mahilota, but both of our pharmacists have done a wonderful job in, managing the vaccine, pulling it out of the refrigerator to warm it up to room temperature. It's got to sit for 30 minutes before they drop the syringes. And then they pass off the syringes to our nurses to go ahead and administer the vaccine. So kudos to them for a great job.
There's a lot of behind the scenes things that people don't know that happen, but there's, the whole team is working, and that's something that we're very excited to see, is the teamwork within our organization. And it's not just doctors and nurses and pharmacists, it's also registration folks, it's
housekeeping and grounds and
maintenance. Charlie, kudos to Mark at Mahalona, for security. He's like my ace in the hole every time. I'm like, hey Mark, when are you working this week? And it's just so many people, maintenance and, making sure we're parking appropriately, keeping people safe in the parking lots. I mean, there's just so much to do to keep everybody safe and functional. And it's been amazing to see the teamwork and the collaboration, that goes on within it. And everybody just takes their part very serious. And so it's great team building.
We've gotten a lot of compliments from the public on the process that we've had at both facilities, but I don't think the community really realizes it's kind of like you get your cup refilled when you're able to do these vaccination clinics and get to know the people in your community and really see the joy on their face after they've gotten the vaccine. And when they get that second dose and they get their card, how happy they are. That's the part that kind of fills our cup back up, because sometimes in healthcare, it's not always the best outcomes that we want. And
this really does.
It makes you feel good.
It makes you feel good, especially when people are coming and they're getting out of their car and they made the time period and we're clapping for them and we're rushing them in to get their shot. And they're like excited and they're like, oh my gosh, you're cheering for me. And it's funny because, we're excited for them too, to get the shot. And so it's very, it's very much a cup filler for us. It makes us happy to be in healthcare, and really being able to get back like this has just been amazing. What an amazing experience.
Well, Kauai has done a really good job, I think, overall with COVID, from our mayor taking some very proactive steps early on and maintaining his posture and his commitment, all the way down to right now, what we're hearing from y'all and the success of the vaccine programs here on Kauai, both with Pfizer and Moderna and different outlets. Sometimes it's a little frustrating because Charlie and I speak to a lot of people on our show and off the show. And we hear others from other counties saying that the reason Kauai is so good is because we're small.
Yeah.
Why not say Kauai is doing well? Because we got good people.
Yeah.
We got good processes and good leaders and good people like you all that put together the system that works. Size is relative, it is. I'm glad we're having this opportunity and our viewers get to hear it from you folks, because you're right. Most people are just frustrated because they can't get the vaccine yet. And they don't know what happens behind the scenes from when that vial leaves, wherever it comes from, the CDC or wherever it comes from, to Kauai. I didn't know all of this until right now, and I'm glad and I'm thankful. I did have a couple of questions. The governor yesterday on the news said we get about 30 to 40,000 doses a week here in Hawaii. This was his yesterday's interview. I would assume, from what I'm hearing, that numbers are distributed evenly based on population throughout the state. But are we having problems with supply based on what we're receiving from the state?
We've been getting our supply, but we don't always know when it's coming. Mm-hmm. So for example, both Wilcox and KVMH and Magellan have these big second dose clinics coming up next week. Mm-hmm. And we weren't sure if we were going to get another, we call it pizza boxes, because the box that has a vaccine is about 9 by 9 and maybe 1.5 inches big. And we weren't sure if we were going to get another one, which contains 195 vials, which is over 1,000 doses. So it would allow us to give our second dose. And we found out today we're getting it. So that's the kind of challenge that we have is, you can plan the clinic dates, but you don't always know until just a few days before if that vaccine's going to arrive or not. And we've been lucky in the sense that we've always gotten what we needed. Yeah. I fear the day that we don't, because then you got to go call all these people and tell them we're going to have to reschedule them. I don't really want to do that. That's going to break their hearts.
Yeah, well, I know the governor had the same concern. We get 30 to 40,000. The problem is you just don't know what you're getting until it's on its way. And
remember, that's Moderna and Pfizer. That's not all Pfizer that's coming in. Right. It's the two different ones that's going different places. To give you a little bit more information on that vaccine shipment from the CDC, It's shipped in a big box that's about 20 by 20 by 24, and it weighs about 80 pounds because it's leaded with all kinds of dry ice slabs inside to maintain. There's a little hollow in the middle that's insulated, and that's where that little pizza box sits with 195 vials of the vaccine. And it's got a temperature gauge on it to make sure that it's maintained the temperature that it needs to be at throughout the entire process. Because if it were to warm up and get too hot, it could invalidate or inactivate the vaccine. So it's monitored by the CDC en route until it gets to us, and then we take it out, and then you actually turn the temperature gauge off on the box itself.
Mhm.
So just to make sure your viewers know that it is safe when it arrives.
Okay,
Now,
and then
let
the other question real quick, and let me put out a disclaimer first, because we get to ask this question a lot on our show, and our answer is the same. Check with your personal physician, your PCP. This is not the doctor's visit with Dr. Fujimoto. This is a informational piece so we can learn about the vaccine and the distribution. But generally speaking, Doc, there's a lot of questions popping up about allergies, people with allergies. Again, call your doctor. But generally speaking, as what has been posted on or stated in many of the news coverages around the country, if you have allergies or if you have had reactions to prior vaccines, contact your doctor. But what's the general suggestion or recommendation by the CDC?
Very, very timely question. The latest health department update that Dr. Sarah Campbell is the acting epidemiologist actually speaks directly to that question on allergies. Previously, I think there was a lot of conservative stance by the health department on allergies. They are very clear now that it says if you have allergies other than allergies directly related to the vaccine products, other than acute anaphylactic type reactions. So allergies to, let's say, prior food, insect, all of those things, talk to your doctor, but those patients can have the vaccines if they're monitored for 30 minutes. So the standard monitoring is usually 15 minutes. Now, if you have that history, and if your doctor allows you to get the vaccine, we would have to know about it so we can monitor an additional 15 minutes.
Perfect. Thank you. I'm one of those. My doctor recommended that I wait because I had a horrific reaction to my hepatitis vaccine close to 30 years ago. So they didn't allow me to take the second or third series, shots in the series. And so she told me to just hold off and wait a little bit, but I'll call her tomorrow. I will call her.
Yeah.
That's good news. That's good news for a lot of us. That's good news for a lot of us.
And the minimum is to watch for at least 30 minutes. But what I've been telling people, we've had a couple people come through that have had bad reactions in the past. And I said, you're welcome to stay here as long as you're comfortable. If you want to stay longer than that, we're happy to have you stay.
Well, I heard you guys have cookies and coffee.
Yes, we do.
That is all I need. I'll bring my own chair.
I'll just let you know where you can sit so that you're 6 feet socially distanced outside.
I'll sit wherever you tell me to sit, but I'll just relax and drink coffee all day and cool.
There's always lots of cookies. Yeah.
The other question that I had is, and we talked about it before privately, but I want to make sure that the viewers can hear this because several weeks ago there was that big, I guess, problem that was caused on the island of Maui when they had travelers that came in and demanded to get the shot because they participated through VAMs. And I remember at that time I asked that question because I had to really go look up what the heck was VAMs, and there it was, and yet there's so many sections within that VAMs that you got to pay attention to. One of it was scheduling. Now I understand you need to participate with VAMs. That's how you get the vaccine. That's one. Two, The part that you're not participating or you're participating after the fact is with the scheduling, right? Because the hospital, you're doing your own scheduling.
Yes.
Okay. So for our viewers out there, I know some of you have written, I just saw a comment that you're worried about people coming in because right now Florida is really facing this problem of having people that fly in for the day from out of country just to get the shot because they can't get it where they're from. But then it doesn't make sense to me. You can take one, but you can't get the second shot. I would think that maybe you would wait until, like, say, the AstraZeneca or the Johnson & Johnson will come out with it's only the one dosage type,
Right.
and you would get it then. So can you kind of talk about VAMS and how that works? Because there's still some people, because a lot of our viewers, it's not only from Kauai, it's from the entire state. And we've got some people on from the island of Maui to give them an understanding, because I think from what their health officer, Dr. Lauren Pang, said, that he kind of was backed up into a corner, but he really sounded like he really wasn't sure. I mean, that's the way I got the impression when I watched him on the news.
Mhm.
And he just went ahead and says, oh, well, she asked for it. So, and even at the press conference, he said, they asked for it, we got to give it. I go, I would think if you guys got a bunch of dosages that you know how many people you got and they were not on the schedule, but they're flying in, I think if anything, they got to wait in the back of the line. If anything you do.
People coming from California.
Yeah.
So we do with the VAM system, we do have, so we upload our patients into VAMs. We don't have you
After the fact.
after the clinic. We don't allow you to go in and schedule, and we don't allow you to do the dose finder, and so that people can see where we are with our thing, because we keep it a little bit more controlled because it's easier to manage for us.
Okay.
So with that being said, people from other states cannot come in and get into our clinics. They can't get into KVMH or Sammy Mahalona's clinics because we control who goes into our clinics. Does that make sense? It's not, you can't go in and just sign up and make your appointment for our clinics. We have to do that. We have to make sure that you're of age and that you can be in our clinic. I do get phone calls. I have people, I talk to people on a daily basis that are from other states that are here and they need their second shot. And I'm like, oh, well, when are you going back to your state? And they're like, oh, in a month. And I'm like, great, you can schedule your second dose when you go back to your state. And that's because you can't get the Pfizer shot before 21 days. But you can get 4 days before, 4 days after is optimal. But you can actually go extend that because there's really no end date as far as how far out you can go from the 21 days. They just want you to have a 21-day window that you don't go too far ahead of that 21-day window to get your second shot.
Mm-hmm.
So what I told her is, and I explained that to her, I said, so when you go back to California in a month, you are still within that, a great time period, make your reservation to get your second shot when you go back.
Yeah, so what I understand about, and VAM stands for Vaccine Administration Management System. Once you enter into the VAMs, the federal government automatically has a second vaccine for you.
Yeah.
And so you have to be matched. If you have a Pfizer vaccine, you have to be matched with a Pfizer vaccine. And as Sherry mentioned, the second vaccine is going to be scheduled almost to the day, 21 days from that first shot. Moderna is 28 days. Saying that CDC, because of, I guess, the president made a proclamation to just release a whole bunch of vaccines. The CDC does say that the second vaccine can be up to 6 weeks.
Mm-hmm.
Yeah, but no, they're not sure about after that what's going to happen.
Okay.
But what we've been trying to explain to people is because of our counts, it's really important that when you start your first vaccine, that you then don't leave island and go somewhere else. And you need to come back and get your second vaccine with us. It's real important that you get both vaccines with us.
Do you
Can't stress that enough.
do you foresee, I mean, with all these other dosages, I mean, providers coming out, like with Johnson & Johnson and AstraZeneca, there shouldn't be a problem because at one time it was brought up where can these vaccines be interchangeable? Like you take one Pfizer and then the next one Moderna if the Pfizer wasn't
Yeah.
available. With everything that's coming online, you shouldn't be running into that problem, right?
So that's right now, if you have Pfizer, they want you to have Pfizer. If you have Moderna, they want you to have Moderna.
Okay.
The UK, the United Kingdom is doing a study right now on what happens if you interchange those two. And they're doing active studies. They're not really sure. I just read the latest on the CDC sites on the vaccination interim reports, and they mentioned that the logic is that it probably should work, but nobody's ever tested it, and that's why they're recommending that you stay with the original manufacturer.
And I guess when they're given the EUA, it was under these strict guidelines, right?
Exactly. Exactly.
So for now, if you get Pfizer, you come back and you get your second dose Pfizer.
Yeah.
Same thing for Moderna.
Yeah.
They did mention that there are some people that forgot what they got the original one from. And that's why VAMS is really important,
Yeah.
because VAMS can actually tell you what your first dose was, whether it was Pfizer, Moderna, or other.
When you got it, what arm you got it in.
And
what
so
time
when
you
we
got it.
upload that data into VAMS, we also we ask people what type of medications they're taking and any medical conditions they have, and that goes in there. And that's in case they do have a reaction. It gives the CDC some information to follow up on for them. So they're tracking that too. We just got a report the other day. They came from the Department of Health. They're able to download the data of how many doses we gave, the ethnic background that we gave it to, male and female, the age groups, and so on. So they're tracking a lot of the data to see who's been vaccinated also.
I do want to make one small announcement because I must get this question every clinic, and I just want to make sure that the viewers know that the vaccine that we're giving you is not a live virus.
Exactly.
And so you cannot get COVID from the vaccine. You cannot give someone else COVID from the vaccine. It is not a virus. So it's real important that everybody understands that. We're not giving you a dampened virus at all. It's not a virus.
Yeah, I think a lot of people,
Yeah.
a lot of people worry about that. And again, I think it comes down to how this, everything's happening so fast with COVID. It changes, like you said. The very first thing you said, Doc, was things change every day, and that's why information is so important, and people stay up to speed. But there's still a lot of people that will not take the vaccine, that they're not comfortable, and I think that'll change over time as more and more people get vaccinated, as more and more evidence of the vaccine becomes public. But like we said in a show a week or so ago, I said, we're living in a time where everyone who's getting this vaccine and participating is a part of history. I mean, we're all part of this big solution that's going to be done one day, and they're all real heroes. Everyone that gets that vaccine is doing their part to help get past these things. So I appreciate you guys a lot. Charlie said early on that the hour would fly by, and it did, but I did want to make sure we give you all an opportunity to share your thoughts with the viewers before we call it a night. So whatever words of wisdom that you may have, Doc, we can start with you, Doc.
I don't know if there's any words of wisdom, except I think it goes back to the basics. This is a virus. It is a new strain that we've never seen, but we've also experienced other new viruses, bird flu, swine flu. This virus is here for the long haul, though. It really is. The basics is the mask, the distancing,
And the hand washing.
washing your hands,
Hand sanitizer.
hand sanitizer. The fallout from that is that travel just spreads the virus. I mean, there was a book I read about pandemics and why this is such a big problem today versus why it wasn't as bad in the years before. And that is worldwide travel. Instantly, someone could be in one country and in the half of the world away in the same day. So there's really no barriers when you think about it. So again, protect yourself and your families, wear your mask, respect the social distancing, wash your hands. Thank you.
And I would just add to that, for those that haven't been vaccinated, the amount of medication that is injected is so small, the majority of the people don't even feel it. I like to stand there and talk to them while they're getting their injections so that they get a little distracted. And a lot of them will look over and go, "When are you going to give it to me? I'm done." So they don't really feel it. Doesn't feel sore. But after they come in and get their vaccination, we do watch them for at least 15 minutes. We do provide the coffee and cookies and some water. And actually, Pepsi's been very nice about donating water to our clinic, so we thank them also.
And for me, even when you do get your vaccine and you are fully vaccinated, and we're all three fully vaccinated, we all have our masks on. So you still need to wear your mask, you still need to do hand sanitation, and you still need to help with the fight. So even though you get the vaccine, you still need to wear your mask. So I can't stress that enough. You gotta still wear your mask and do everything like Dr. Fujimoto said. So, and I keep my little hand sanitizer in my pocket at all times. So, it's always good because you don't want to spread it. And if you have young children at home, they're not able to take the vaccine at this time. So we still got to protect everybody else around us in our community.
So can I also thank you, Mel and Charlie, for inviting us to the show.
Yeah, thank you very much.
We appreciate the ability to answer questions and share our story. So thank you.
Thank you.
Well, we're gonna. I know I saw Jackie. She emailed me last night, and we definitely will have you folks back. We'll definitely have you folks back on the show. And just one real quick question: when I go get my vaccine, can I bring Charlie with me so he can hold my hand?
Of course you can.
I am a hand holder. I do tend to hold people's hands, so come to Boston and I'll hold your hand.
My biggest allergy is to needles and pain. That's why, I'm allergic to needles.
Our nurses giving the shots, and they're super quick. They're very fast, and as Cheryl said, people don't even realize they're getting the shot. They're like, "You're done," and so
it's more the anticipation of it than anything, I think.
Mm-hmm.
Yeah, I'm already sweating. I'm just talking about him, and I'm already sweating. Charlie.
Well, first, I'd like to take this opportunity to thank our esteemed guest tonight, Dr. Fujimoto, Cheryl, and Sherry. Thank you so much for joining us and for at least sharing with the viewers your knowledge about the vaccine rollout and, what's to be expected. I really, really appreciate that. To our viewers out there, one thing that was said, and that is over the horizon, we have all these vaccines coming out, but it's going to take a lot in way of modifying our behavior, because our behavior is the one that's going to get us in trouble. If we assume that just because we got vaccinated, that nothing's going to happen, maybe something may not happen to you, but you got to think about the person next to you. You won't know if that person got vaccinated or not. So just take it knowing that, the person is not vaccinated. That's why you have to ensure their safety as well. So I hope if you're watching this, please, and if you already got vaccinated, please pass the word on to your friends who are getting ready to take the second shot. Now is not the time to let down your guard, because the jury, like I said before, the jury is still out about how this vaccine is going to work on us. And until we can get that full information that can be printed, that can be reviewed, and everybody says, okay, we have a consensus that it definitely works and it's doing what it's supposed to do, then we can have a sigh of relief. But until that comes, let's just stay on guard. So I appreciate all the help. To our viewers, what you saw tonight, and hopefully that you walk away with some knowledge of what it takes to have a vaccine rollout. Mel?
Thank you, Charlie. Thank you to our panelists, Doc and Cheryl and Sherry. And it was so funny. I said, I need headshots from all of them. They sent me pictures. Well, I could figure out who Dr. Ronald Fujimoto was, but the other two, I didn't want to mess up the names. I said, Jackie, you got to tell me which one is which. She said, Oh, Sherry's the blonde one.
Well, this is gray.
Oh,
Anyway,
but you remember what I wrote to you? I said, no, Sherry is the one with the kinky hair.
yeah.
You're the one with the most.
Yeah, Charlie saved the day when he said. Anyway, thank you so much, and you know, again, that's what we try to do, just bring factual data information to our viewers. I don't know if you guys have Facebook running, but the comments are all positive. We just appreciate what you guys do, your commitment. It's 8 o'clock. You guys are obviously still at the hospital with the big whiteboard behind you. You didn't have to do this tonight. We appreciate just the logistical nightmare of this thing. If not for people like you, we just been in a world of hurt. So thank you from all of us.
Yeah,
Thank you for your
you.
service. Viewers, appreciate you guys again tuning in. Tomorrow night we'll have Josie Howard she's from Oahu. She's the representative of the Pacific Islander community. She's going to share with us what's going on Oahu and throughout the state as we try to reach out to our Pacific island communities, because those are the hardest hit demographics. So we'll have Josie on tomorrow night. It'll be an interesting show. I hope to see you guys then tomorrow night, 7 o'clock. Until then, you guys all stay safe. God bless. We love you folks. Take care and
Aloha.
aloha.
Bye.